Mr. Heller, followed by me.
Mr. Chairman, I want to thank you and the ranking member for holding this hearing today on Graham-Cassidy-Heller-Johnson. And I want to thank my colleagues, Senator Cassidy, Graham, former colleague, Senator Santorum, Senator Johnson, for their leadership on this particular proposal. And when these senators came to me with an idea that would fundamentally change the way our healthcare system works, when they told me that this plan offered Nevada more flexibility and more funding to meet the needs of our patients, I said, sign me up. Our proposal represents what I set out to do from the very beginning of this summer's healthcare debate, and that's to do what's best for the state of Nevada, the citizens in our state, and across this country. And we all know that Nevadans and Americans across this country are facing higher costs and fewer choices under Obamacare. As a small government conservative, I believe any solution to our broken healthcare system needs to be rooted in increased flexibility with the goal of enhancing affordability and access to coverage. A one-size-fits-all approach isn't the answer, so what is the alternative? And that alternative is to remove Washington from the decision-making process. Allow a 50-state solution where each state is empowered to do what they think is best on behalf of their patients. In fact, 2 weeks ago, I held a telephone town hall meeting where I heard from a nurse in Las Vegas who was also a patient advocate. She brought up the Graham-Cassidy-Heller-Johnson plan and said she's glad people in Washington, D.C. finally get it. She agreed that it's essential to bring healthcare decisions down to the state and local levels to improve the quality of care in this country. Our proposal takes Obamacare funding and replaces it with a block grant given annually to states to help individuals pay for their health care. This plan gives states the flexibility to innovate and create health care systems that will lower premiums, expand coverage, allow states to serve their Medicaid population as they see fit. This proposal presents states with many options for coming up with a tailored approach most appropriate for their citizens. For example, states like Nevada that have expanded Medicaid can continue serving this population with their block grant dollars. And because Nevada won't be on the hook for the 10% match required under Obamacare in 2020, the state will save $1.16 billion. As someone who recognizes the increased needs within our state as a result of the state's decision to expand Medicaid, these provisions are critical. Our proposal also allows states to use up to 20% of their block grant dollars on traditional Medicaid, providing states with additional flexibility to serve individuals who rely on this program. Understanding that Nevada is committed to providing affordable, quality care to our patients, including the most vulnerable, our proposal allows them to advance these efforts. For example, Nevada can enter into arrangements with insurers, including managed care providers, to continue its commitment to vulnerable patients, as well as ensure that Nevadans who rely on Medicaid have access to the services that they need. Under this proposal, states can also access additional funds that will allow them to address urgent health care needs at home. These are just a handful of examples of how states can benefit from this proposal through increased flexibility. Senator Cassidy, Graham Johnson, and I believe that our plan is the best path forward to address our nation's healthcare challenges, so I'm grateful to the chairman for allowing us this opportunity. Quick question to you, Mr. Cassidy. Could an expanded state like Nevada use the money to replicate their current Medicaid expansion system?
Absolutely. Senator Heller, folks say you're losing the Medicaid expansion dollars. No, you still get them. You just get them in a flexible block grant. And if you wish to fund opioid services, you can fund opioid services. If you wish to do something good to decrease the transmission of HIV, you can do that as well. So absolutely, you pegged it. You can keep the money. You can keep on doing what you've been doing if you wish.
It was mentioned earlier that 40% of Obamacare dollars are spent on 4 states: California, Maryland, Massachusetts, and New York. Do you think and they only represent 22% of the population. Do you think this speaks to an equity issue inherent in the current system?
It does, and as a doctor who worked in the public hospital of Louisiana for so long trying to bring services to those who do not, the idea that you could somehow get these folks in an orange state equity. No matter where you live, you can still have access to the same level of support from the federal government, and your state doesn't go bankrupt because it has to come up with a match, which Ms. Miller tells us that Pennsylvania is going to have a hard time doing because we waived the match. We think we get to where we need to be.
Does this legislation give Nevada more dollars with more flexibility?
Correct, correct.
Thank you. Mr. Chairman, thank you.
Thank